Hello everyone. In this class we'll continue with the another class of antihypertensive. Those are sympathetic blockers. So here in the sympathetic blockers we'll discuss about the beta blockers, and we'll continue with the alpha 1 blockers, and we'll continue with the central sympatholytics. So before that, we should know what do you mean by sympathetic blockers. So here sympathetic blockers means they blocks the effects of the receptors present in the sympathetic nervous system. Okay, so what are the receptors in the sympathetic nervous system? The receptors in the sympathetic nervous system also considered as adrenergic receptors. Okay, so means what? So these blockers, sympathetic blockers, also called as sympatholytics, they blocks the effects of the adrenergic receptors. They reversibly blocks the effects of the adrenergic receptors. How here these adrenergic receptors, here the sympathetic nervous system may innervated to the various organs. Here it may innervate to the eyes, it may innervate to the heart, and it may innervated to the lungs, and it may innervated to the kidneys, and it may innervated to the blood vessels. Okay, so these are the various organs. Sympathetic nervous system may distributed to all these organs. Okay, so here in case uh, these organs may contains these receptors. Okay, so whatever the neurotransmitters, those are released from the sympathetic nerve endings here. Okay, whatever the neurotransmitters, which neurotransmitters? Majorly the catecholamines, adrenaline and noradrenaline, so that are released from the sympathetic nerve endings may act on the receptors present on these all the innervated organs. Okay, so these here the receptors for this adrenaline and noradrenaline is considered as the adrenergic receptors. So these adrenergic receptors may be different types. Different organs have different types of adrenergic receptors. So broadly these adrenergic receptors are considered categorized into two types. So what are those? Alpha receptors and beta receptors. Okay, so broadly they are categorized into alpha receptors and beta receptors. So and then so these alpha receptors and beta receptors may be again classified into alpha 1 receptors and alpha 2 receptors, whereas beta receptors are again classified into beta 1 receptors, beta 2 receptors, and beta 3 receptors. So here alpha receptors. So in that again we have alpha 1 receptors and alpha 2 receptors. Here alpha 1 receptors are majorly present on the blood vessels, and it is present on the sphincter trigone muscles of the bladder, and it may also present on the sphincter of the gastrointestinal tract, and it also present on the radial muscles of the eye. Okay, so it may associated with vasoconstriction, it may causes the dilation of pupil, and it may causes the contraction of the sphincter, so thereby it may leads to constipation. Okay, so whereas here the alpha 2 receptors, they are present on the pancreas, so they decreases the insulin release, and they may present on the CNS, so which by stimulating the alpha 2 receptors are generally considered as the inhibitory receptors. They majorly have a inhibitory effects. Here they present on the same preganglionic nerve endings itself. Okay, so on the same nerve endings the receptors are present, and the stimulation of which can decreases the release of the norepinephrine, and it is also present on the CNS in the medulla. Okay, so stimulation of alpha 2 receptors in the CNS may decreases the sympathetic outflow, and also present on the platelets, and which decreases the insulin, and it may also associated with platelet aggregation. So these are the effects of alpha receptors. And here the beta receptors, these are present on the three organ. Here there are three types. So one are beta 1 receptors, beta 2 receptors, and beta 3 receptors. So here beta 1 receptors are majorly present on the heart, and also on the juxtaglomerular cells of the kidney. So here when what happened when these beta 1 receptors are stimulated, they are associated with increased heart rate and increased force of contraction. So when the sympathetic system is activated, whenever the fright and flight situations, this system is activated whenever whenever the energy is needed. So whenever we want to run, whenever we want to do exercise, so when by through frightened whenever we want to run. In that situations only it will be activated. So that's why what happened at that time, we require energy and we require a blood supply. So for that reason, so here the sympathetic nervous system is associated with the increased heart rate and increased contractility. So thereby uh, which increases the perfusion of the various organs, especially the skeletal muscles. Okay. Apart from that, which also increases the renin release from the juxtaglomerular cells, whereby it increases the blood value. Okay, so these are the effects of beta 1 receptors, and here the beta 2 receptors majorly present on the bronchial smooth muscles and also on the blood vessels. Here alpha 1 receptors are associated with vasoconstriction, whereas beta 2 receptors are associated with vasodilation. Here it may responsible for the both are having the opposite actions, whereas alpha 2 receptors directly they also present on the blood vessels, they also causes the vasoconstriction. Okay, so here uh, beta 2 receptors are associated with bronchodilation, vasodilation, uterine relaxation, skeletal muscle contraction, and glycogenolysis. All we require energy, so that's why glycogenolysis is promoted. So for exercise, skeletal muscle has to be contracted, so that's why skeletal muscle contraction is promoted and vasodilation is promoted, and breathing is needed, so that's why bronchodilation is promoted. So all these are mediated through the beta 2 receptors. So and finally the beta 3 receptors, these are present on the detrusor muscles of the bladder. Okay, and also present on the adipose tissue. Detrusor muscles means here this is the these are the trigone muscle or sphincter muscle, and these muscles here is considered as the detrusor muscles. So when urination too takes place, so these muscles has to contract and these muscles has to relax, but this is takes place in case of parasympathetic nervous system. So here in case of this, because of the alpha 1 receptors, these contraction of these sphincter may takes place and relaxation of this detrusor muscle will takes place. So that's why what happened, urinary retention may hold the urine. Okay, urinary retention may takes place because of this action. Okay, and also present on the adipose tissue, so that's why lipolysis may takes place. So example of agonist on this beta 3 receptors are the mirabegron. So this in this way now we can understand what are the effects of the alpha receptors, what are the effects of the beta receptors, so we can understand, right? So then when these receptors are blocked, what the effects they produce we need to understand. So in here uh, in what situations we are using it in a hypertension, right? So here we use alpha 1 blockers and we use alpha 2 agonist. Instead of blockers we use alpha 2 agonist because it has an inhibitory action. So especially we use central sympatholytics, we can stimulate the alpha 2 receptors in the CNS. So then what happens, sympathetic outflow is decreased. So whatever, once the sympathetic outflow is decreased, all the effects of sympathetic nervous system is decreased. Okay, so in that way here we can use central sympatholytics are nothing but alpha 2 agonist, central alpha 2 agonist, and then alpha 1 blockers. How the alpha 1 blockers works? So they cause vasoconstriction. Alpha 1 receptors are associated with vasoconstriction. So once we block the alpha 1 receptors, this vasoconstrictor effect is blocked, so thereby which causes the dilation of both the arteries as well as veins. So thereby they reduce the total peripheral resistance. At the same time they reduces the blood volume and cardiac output. Okay, so then how the beta blockers reduces the BP? Majorly the primary mechanism of action is by reducing the heart rate and force of contraction. So once the heart rate and force of contraction is decreased, cardiac output is decreased, so that's why the blood volume within the blood vessel is decreased, ultimately blood pressure is decreased. So these are the mechanisms how the sympathetic blockers may work. Okay, so we'll see clearly about the various sympathetic blockers. So first we'll discuss about the beta blockers, because beta blockers are considered as the first line antihypertensives because they do not cause fluid retention, and it has it has a cardioprotective function. Because of that they may be used as a first line antihypertensive drugs. Okay, so we'll see everything in clearly. So here again they said, here in this slide again the actions of beta adrenergic receptors has been discussed. Okay, so here beta 1 are present on the heart and beta 2 present on the lungs and beta 3 is present on the fat cells. How the beta blockers works? They acts by blocking the beta 1 receptors in the heart and beta 1 receptors in the juxtaglomerular cells. So then what happened? So because of this, what happened? Because of this, here heart rate is decreased and force of contraction is decreased, so thereby the cardiac output is decreased, bp may fall. So this is the common mechanism of action for all the beta blockers, but these beta blockers may be of different types. So some may directly stimulate the beta 1 receptors itself, some may are non-selective beta blockers, either they stimulate both the beta blockers and beta 2 blockers. Some may have intrinsic sympathomimetic activity, means they are blockers itself, but they also have some agonistic activity, partial agonistic activity itself. So and some may are having additionally alpha adrenergic blockage, means they block both the alpha receptors as well as beta receptors. So there are different types of beta blockers. So that's why the overall mechanism of action is same. They acts by decreasing the heart rate and force of contraction. Finally, they reduces the fall in BP. But because of different types of beta blockers are available, so different types of beta blockers may elicit different types of they have different types of properties. So for example, when we use selective beta 1 blockers, they only reduces the heart rate and they only reduces the fluid retention. So they do not have any other effects. But in case of when we use non-selective beta blockers, apart from blocking these effects, they also blocks the bronchodilation, they also blocks the vasodilation, they also blocks the uterine relaxation, they also blocks the skeletal muscle contraction, they also blocks the glucogenolysis, they also blocks the increased action of aqueous humor. All these effects also blocked. Okay, so that's why they have adverse effects as well. Okay, when the vasodilation is blocked, especially on the coronary blood vessels, which may exacerbate the vasospastic angina. So when the bronchodilation is blocked, which may causes the exacerbation of asthma, it should not be prescribed for asthmatic patients. So if glycogenolysis and skeletal muscle contraction is blocked, so person is unable to do his regular works, regular daily activity may reduced. So and it is also has an adverse effects on the CNS itself. It may causes the nightmares, it may causes the bad dreams like that. Okay, these are the adverse effects we can see with non-selective beta blockers. So here when we see uh, so that's why selective beta 1 blockers are preferred over the non-selective beta blockers to overcome this effect. So this is regarding the selective beta blockers and non-selective beta blockers. So whereas we have another two categories of beta blockers as well. What are those? So those are uh, beta blockers with additional alpha adrenergic blockage. When the additional alpha adrenergic block, if apart from blocking the beta receptors, when we block the alpha receptors, vasoconstriction is reversed. So thereby they causes the marked vasodilation. So that's why they are used in the hypertensive emergency conditions like that. Okay. So clonidine withdrawal condition, in case of cheese reaction, emergency situations, we can use those drugs. So another category of beta blockers are the beta blockers with intrinsic sympathomimetic activity. Means intrinsic sympathomimetic activity means they have some agonistic activity apart from blocking activity. So here agonistic activity means here because of blocking activity, they decreases the heart rate and force of contraction. So because of agonistic activity, they increases the heart rate and force of contraction. So that's why they causes the slight reduction in the heart rate and force of contraction. So so vasodilation, vasoconstrictory effect is blocked because of this agonistic effect. So this vasodilation is not that much affected. So it has advantages as well as disadvantages. Among all these, selective beta 1 blockers are preferred over remaining. Okay, because of the uh, because it only acts on the heart. Okay, so this is regarding the different beta blockers. We'll see what are the various here, how the beta blockers acts. They acts by blocking the beta adrenergic receptors, especially the beta 1 receptors. So when the beta 1 receptors are blocked, these are the G protein coupled receptors. Ultimately the cyclic AMP GS type, ultimately the cyclic AMP levels are decreased, so ultimately the calcium influx is decreased, so thereby heart rate and force of contraction is also decreased, and the renin release and RAS activation is also inhibited, so which together causes the fall in BP by due to decreased cardiac output. Okay, and then how do what are the various types of beta blockers? Here the beta blockers may be different types. What are those? Here we already discussed. One is non-selective beta blockers, and another one is the cardio-selective, only beta 1 selective beta blockers, and another one are the non-selective beta blockers, means they block non-selective adrenergic blockers. They blocks both the alpha receptors as well as beta receptors, and some may have intrinsic sympathomimetic activity, agonistic activity. So those are pindolal example is. Okay, so non-selective adrenergic blockers are labetalol and carvedilol. Cardio-selective beta 1 selective are atenolol, metoprolol. So non-selective are propranolol, nodolol, timolol, etc. Okay, so these are the examples of various types of beta blockers. Already we discussed what are the effects of different types of beta blockers. So then we'll see the complications of beta blockers. So we already discussed while discussing, but we'll discuss again. So here what happened when the beta receptors are blocked? So here which decreases the heart rate, so that's why which causes the bradycardia. So because of decreased heart rate, decreased force of contraction may precipitate the CHF. In CHF what happened? Congestive heart failure, cardiac output is reduced. Okay, if we use beta blockers again, it may precipitate the CHF. Okay, so then here which causes the AV block. Beta blockers may reduces the AV conduction, and then which may causes the precipitation of vasospastic angina because of the blockage of vasodilatory effects of beta 2 receptors, and here bronchospasm because of beta 2 receptors are blocked. So because of hypoglycemia, and then because of skeletal muscle contraction is inhibited, so that's why which may causes the decreased daily performance and all those, and which may increases the lipid content, and it may causes the bad dreams, insomnia, dizziness, depression and all this, and because of the dilation of the GI muscles, so which causes the constipation and all this. So these are the effects of the and it also causes erectile dysfunction because, so here vasodilation is necessary for the proper erection. So if it blocks the vasodilatory effects of the beta receptors, so thereby it causes the erectile dysfunction as well. Okay, so sudden withdrawal of the beta blockers may causes the rebound hypertension. Okay, so these are the side effects of the beta blockers. However, having all these side effects, so these are cardioprotective, and because they prolong the disease progression, they prolong the cardiovascular remodeling and all those, and they do not cause postural hypotension, they do not cause the fluid retention. So because of all these effects, so they are useful in the they are still considered as the first line antihypertensive drugs. Okay, so then we'll go for alpha blockers. Okay, so how alpha blockers acts? So alpha blockers acts by blocking the vasoconstrictory effect of the alpha 1 receptors. Okay, so when the vasoconstriction is blocked, so which ultimately which causes vasodilation, decreases the total peripheral resistance and decreased blood pressure. Okay, so but they causes the marked vasodilation, especially the arterioles. So because of marked vasodilation, initially they causes the initially the balanced mechanisms are not activated, so that's why which causes the hypotension, especially in the standing position, which causes the orthostatic hypotension. So that's why alpha blockers should be used in lower doses in the beginning. Okay, and then because of marked vasodilation upon chronic use. So, because of this marked vasodilation, if when we used for a longer period, so which causes the stimulation of the baroreceptors, because of the sympathetic system balanced mechanisms gets activated. So because of vasodilation, so that's why the sympathetic system may gets activated, and which may to restore the fall in BP, marked fall in BP. So that's why it may lead to tachycardia and RAS activation. So this RAS activation may causes the fluid retention. So this fluid retention may blocks the fall in BP caused by the alpha blockers. This is the disadvantage of the alpha blockers. However, it is having all the desired actions. So because of this fluid retention upon chronic use, so which may causes the development of resistance to these drugs. So this is the drawback for these alpha blockers. That's why these are not considered as the first line drugs. Okay, so then coming to the side effects, because of not only blocking the blood vessels, alpha 1 receptors in the blood vessels, so it can also block the alpha 1 receptors in the other organs. So that's why, which may causes the ejaculation defects, and it may causes the blurred vision because of the blockage of mydriasis, and it may causes the blood vessels dilation of blood vessels within the nasal mucosa. So that's why causes the nasal blockage. So because of reflex sympathetic stimulation, which may causes the palpitations and dryness of mouth, drowsiness. Okay, so these are the side effects. Okay, so then apart from the hypertension, which is also used for the benign prostate hypertrophy. Okay, so another category of sympathetic blockers, these are not generally considered as a blockers. Why they are considered as sympatholytic means they reduces the outflow of sympathetic nervous system from the brain. So that's why they are considered as sympatholytics. But how this response is taken place? Because of the stimulation of alpha 2 receptors in the CNS. So that's why they are alpha 2 agonists generally, but they reduces the effects of the sympathetic nervous system. That's why they are considered as the sympatholytics. How they works? So they works by stimulating the alpha 2 receptors in the brainstem, especially in the medulla. So thereby what happened? They decreases the sympathetic outflow, norepinephrine release from the brain. So that's why what happened? All the sympathetic effects are blocked, especially in that heart rate and force of contraction and vasoconstriction is blocked. So thereby which reduces the BP. Okay, so then coming to the side effects, so each has an individual side effects and individual uses. Here the clonidine is used in case of refractory hypertension, not as a first line drug in hypertension. So here because sudden withdrawal may causes the withdrawal symptoms, sudden rise in the BP, sudden rise in the heart rate, and sudden rise in anxiety, restlessness, and all those symptoms. So that's why it does not considered as the first line drug. But in the refractory cases, we can use clonidine. So apart from that, it has a central effects like sedation, mental depression, and may, because of sympathetic nervous system effect, blockage of sympathetic outflow, decreased sympathetic outflow, which may causes bradycardia. Because of decreased sympathetic outflow, renal blood flow is decreased. So thereby RAS activation may take place. Okay, sudden withdrawal may causes the increased clonidine withdrawal symptoms. So that's why this is not preferred as a first line drug. Here the methyl dopa, so which is safe in pregnancy. So that's why still it is used as a drug of choice in pregnancy for treating the hypertension. Okay, so here it causes the central effects like sedation, mental depression, cognitive impairment, hypotension, postural hypotension, dry mouth, along with that which causes nasal blockage, and especially it causes the hepatitis and hemolytic anemia and thrombocytopenia. So these are the side effects of the methyl dopa. So this is regarding the various beta blockers.